Welcome back, you beautiful Bravehearts worldwide. I'm Dr. Daryl Wolf, and today I have the pleasure and the honor, of interviewing Margaret Stock. Now, you might go, well, who's Margaret Stock? Well, Margaret Stock is actually a master practitioner. That's how we met. She came, she wanted to enhance some things in her practice. But understand something. Before she came to take our whole life coach certifications, our Wolf non-surgical certifications, understand something. She was one of the leading professionals in her profession. And understand this. It's been a while because she's very busy. That's what her life is. You know what? Successful people and usually happy people can be very busy because they're enjoying their life. And it's been a while, and it's taken some time to get her to actually come on the show. And guess what? We've actually convinced her to do her own show. And it's going to be a regular show. And you are going to love this information. And her show is called Breathing, Feeding, and Beyond. And I'm going to tell you something. The information she has, I don't have it. I have some of the information because we talk together, but I'm going to tell you something. I know this much really good, okay? All right? I'm just in my infancy, okay? I mean, learning never ends when you have a craving to know the truth. Welcome to the show, Margaret.
Welcome. Thank you so much for having me, Dr. Wolf. I am honored to be here.
Well, we're honored to have you. And where are you right now?
So I'm on the road, actually. I right now am in Sacramento, California, and on the way to Napa Valley. I am going to be doing some trainings. So just, always growing and developing and, going after new set of skills and knowledge. So whatever I need to do to improve, first of all, my quality of life, then my family, and then the people around me, so that I can be a practitioner and a provider for the community that we serve.
And if you don't mind, things just pop into my head. But I think you feel the same way that I do, that there is no billionaire tyrant or terrorist that will ever take us off our passion, and we're going to have the same success that we would have 5 years ago for the next 5 years, because nothing's going to get away in the way of our passion and our purpose, living and giving, loving and laughing and dancing. And we're not going to buy into their BS, okay, which is their dysfunctional belief systems. And I need everyone to get this, that I want to create a platform, Braveheart Nation, BHN TV studios, to bring on people to tell you that they're full of shit, excuse my language, and they're trying to scare everyone. And understand something, I guarantee you that Margaret has not been taken off the marker at all, and she's staying to her passion and purpose. Remember something, fear is one of the greatest things that distract us and disturb us, and it takes us from our living and giving. What do you think, Margaret?
100% agree. I have not been, fearful of whatever's going on. I just stay my course, just kind of, laser focused on the goals that I have, for myself, my family, my practice. And, there's nothing out there that can, shake me or, whatever. So, I agree 100% with you. There's nothing that can stop me. I live for my passion and my purpose, and to serve the people that come, to, seek help from me. So, that's what I do.
And understand everybody, the one thing that we have learned as a whole life coach, professionals, is we don't get angry. Okay, so was I upset when I just said that little bad word? No. But I'm telling you right now, that word is to wake up everyone and tell you that, guess what? The only way that they can enslave anyone, whether it's corporations, the government, and everything behind that, is if you buy into their fear. You don't do that. You stay the course. What is your passion? What is your purpose? And right now, we're going to find out what Margaret's is. What's your passion, Margaret? What's your purpose? Tell us about your clinic and where your clinic is, and I know that you have professionals working for you, and I know that you do an array of different things. But let's let people know who you are, and then let's talk about. Or not let's us talk about, but you talk about the different things that you're going to be talking about on your show. Okay.
So my practice is Advanced Therapy and Wellness Center, and we're located in Crest Hill, Illinois, right outside of Chicago. And my professional background, and I'm a speech language pathologist. I specialize in feeding, swallowing, and myofunctional disorders. I work with people of all ages, including infants, children, all the way through adults. And I've been a therapist for 14 years. About 7 years ago, I found this passion for myofunctional disorders because of the issues that my own kids had, and going from, provider to provider and trying to figure out how to help my own son. I was so fortunate that I met some people in my life that guided me to this information. And then from there, I just, fell in love with it. It is, looking at the root causes of things, not just putting Band-Aids on symptoms, right? So from there on, I just kind of went into this whole rabbit hole of airway and breathing and, dysfunction of the mouth and what that all can what kind of impact it can have on the overall health, not just physically, but also mentally, and, what kind of damages, happen to the brain and things like that when your mouth is not functioning properly. So that's kind of how I got into all of this. And 6 years ago, knowing what I knew, I knew that I couldn't practice the way I wanted by looking at root causes and giving people the information that they really needed to help themselves and their kids. I left my hospital job and I started my private practice. So,
if I can say something, everybody, you need to get this centralized medicine. This is not to create drama, but centralized medicine is harvesting for big pharma. And we need to decentralize healthcare. That means that we need to actually, if we needed anything in this country, in the United States or any other country, what we need a Health Freedom Act where people are allowed to practice whatever they're allowed to practice, as long as they're not doing harm, and that mothers and fathers should be allowed to pick the choice of healthcare as long as they're not doing harm. But you can get a mother and a father, which back me up on this or don't, Margaret. You can get a mother and father that if they go into centralized healthcare, which is the medical system, and they want to take a detour and then do it naturally, the state will tell you that they own your kid. And the reality is I'm not trying to take you off track, Margaret. I'm just trying to tell you that this is why somebody with a conscience and somebody that understands and is connected to that which we call source is not going to stay there. And they're going to break away, even though it's much harder to break away and go on your own and then be attacked by the profession that you thought you wanted to do. Am I right or wrong, Margaret?
100%. And I see this every day. The insurance world controls everything, and that they tell you where you can and cannot go, what services or what, care you can get. And it's really, really unfortunate. We see this all the time where, parents, don't have the coverage for insurance, and they have to make that choice not to seek services because it's not covered by the insurance when it's absolutely needed for, themselves or the child. We also have, pediatricians and other healthcare providers, saying that what we do is, money driven, or, there's no research behind it, and, there's no evidence and things like that. But all of that is not true. There's plenty of research behind what we do. There is, plenty of data there. All the things that I do in the practice the last 6 years, I have thousands of patients that I've worked with so far. And, we're changing people's lives. And especially when we get these children early on, and we're able to kind of set them on the right path, we're changing their trajectory of, their health, their, mental state, their ability to learn at school, and, what kind of person they're going to grow up to be, because of we giving them the basis of health and the way they're functioning in the world. So I like to say that my job is to empower people to take responsibility for their own health and responsibility for their children's health, and not rely on what the pediatrician says, or what the insurance says, whether the service is covered or not. I tell my moms that you have to trust your gut. The pediatrician sees your child, your baby, for 5 minutes. They don't know your child, and
Right.
we tell you things are normal. It's not true. There's a lot of things that are common, but they're not normal.
Yeah, common doesn't mean normal. And understand something, everyone. It's not about me, but I'm going to be doing a stat of the day, and Margaret, I'm going to be doing a thing every day and showing a stat. Okay, I might only go back 10 years, or I might go back 20 years, or I might go back 30 years, and I will show everyone that we have been lied to, and they've been very deceitful, and they've hidden things, and they've switched things around. And I'm going to show people that we've never been so sick in our life, and that the world hasn't turned on us. God hasn't turned on us. Okay. Corporations have turned on us. And once you start telling people statistics, they start waking up a little bit, because they don't have a reference point. People don't have a reference point. Nobody goes back 20 years, 30 years, 40 years, 50 years and takes a look. They look at what today is normal when it's abnormal.
100%. And looking at statistics too, even with, kids and autism rates and ADHD rates, learning disabilities, excuse me, kids that need services at schools because they can't attend, they can't learn, and they can't, participate. And, these kids are just being put on medication, and, they have, loads of services. They're being pulled out of classroom. They're missing the educational content because they're, needing to receive services. All of that is just crazy. The numbers, of kids that, have an IEP at the school and require services, and, the kids are being put on medication. We have patients at our practice that are, 4, 5, 6 years old that are on ADHD medication.
And do you know why? Because we don't matter. We're less than cattle. And that's it. Everybody, you need to get this. You got to get your head out of the sand and understand. I see that people are coming on with questions. Listen, everyone, you can send your questions into Facebook, Instagram, TikTok, and YouTube. Facebook, Instagram, TikTok, and YouTube. You can actually then text me if you are not on any of those other platforms at 469-861-8884. Okay, text me. And your questions for Margaret, and let's get them answered. And when we do these shows, we will give you the opportunity of asking your questions. Don't be shy. Step up to the plate. If you're not willing to challenge Margaret, if you're not willing to challenge me, if you're not willing to challenge yourself, then you're not going to grow. Margaret?
100%. But going back to what I was saying, parents need to really look into, what is going on, not settle for what's common, right? And start using like your brain and think about it. Like, if it doesn't make sense to you, it's probably something that is not right. And making sure that you seek the provider that has the answers to what is the root cause of the issue, the symptoms, right? Not just
but Margaret, you're not going to get the root cause out of a hospital. You're not going to get the root cause out of a pediatrician. You're not going to get the root cause off a commercial. You're not going to get the root cause out of a magazine, correct? And that is correct.
And even if you go to another speech language pathologist, because everybody's trained by the systems. I went above and beyond to get the education that I have, and none of what I know was taught to me in my master's degree program. Everything I had to go out and seek other people's skills from various providers, from neurologists to ENTs to dentists, orthodontists, people that sleep medicine doctors, nutritionists, and we have to look at it the big picture. You can't pick pieces and just like, oh yeah, you need this for this and you need this medication for that. You need to be able to look at the person holistically and address the root cause. If you don't, even for a speech disorder, if I have somebody coming in because their child has a hard time with articulation of speech, right? What's causing it? It's not just, okay, throwing them into therapy and let's drill this sound. What is the root cause of why they can't articulate?
Well, but I know, but you know what? Just want everybody to know that please don't sit there with regret with the things we're talking about today. You're not stupid. You're not dumb. You're not slow. You're given a manual that doesn't work because, a lot of people don't like what I have to say. But the reality is that almost every university PhD is just a salesman for the government or for big corporations, and that's it. And that's all I'm going to say. If you don't want to go off the beaten path, and that means that you're going to have your family actually talk down on you. Everybody in your family, your friends, okay, are all programmed. If the medical system never did anything and we never learned anything about health, we would all be healthier. Understand, we're not even in a neutral point. We're in such a negative state that we have to relearn and rethink, and most people are never going to do it. So if you actually want to have health for yourself or your children, you're actually going to have to put up with everybody telling you that you're a danger, even though you might be just doing a whole plant-based food diet and different exercises and using the purest nutraceuticals on the planet and instead of drugs. And that person that loves you in your family is going to tell you, you need to get them on these drugs, and you are such a whack job thinking that it's a nutritional thing. Margaret, what do you think?
Yes. 100%. And, I tell my parents that, they have to be brave, right? And stand up for what's right for them and for their child. So we educate parents on everything that we do, so that they understand, because health is not a complicated thing. It's just we're taught to not think about it because we're giving our power away to the medical system, the doctors, the school system and whatnot. So we don't take the time to think about it. We don't take the time to learn it. We don't take the time to, really just understand the cause of things that are happening, right? There's always a root cause of everything that we are dealing with. And so you have to stand in your power and say, okay, no, this is what I'm going to do for myself or my child, right? And I don't agree with this medication or that. There's more to it. And you have to be, that brave heart to be able to do that, because from everywhere, everybody's, telling you you're stupid, or you're this or you're that. And, everybody's going to try to kind of steer you from doing what is actually right. So,
yeah, human beings have the potential of being high vibrational, intelligent beings. But the reality is the majority of the population doesn't realize that the brain is just a computer and anybody can put a program in it. And these programs have been going on forever. But can we talk about what you'll be doing on your program?
Sure. So thanks to Dr. Wolf, I'll be coming on and talking about the basics and, going to the baseline of our existence, of our health. And, my passion is really for the babies and trying to reach as many parents as possibly can, because I know that if I can get to a baby early on, we're able to make such a difference for those children and set them up for a lifetime of, good health. So that is where my passion is. But there's never too late to address some of these things. We work with children of all ages. We work with teenagers and adults that have not had the opportunity to look at all these things and have been struggling their whole life.
What conditions are they struggling with? Like, what are the main conditions that people are struggling with that cannot be resolved? Okay, there's no answer out there, or they are being mistreated, not treated properly. That's what I like to know.
Yeah. So starting with the babies, we're looking at feeding ability or feeding skills for the baby. So, the natural way for the baby is to breastfeed. And if the mom chooses to breastfeed and there's an issue, the baby's having a hard time latching, the mom's in pain, that is not normal. Regardless of whatever the doctor says, the lactation consultant says, babies have the innate ability to be able to latch onto the breast and be able to, eat from the breast, right? And if there is a disconnect, there is a problem with it, there's a root cause for it. And even if the mom chooses not to breastfeed, looking at, what bottles are we using? What's best for proper growth and development of the face? What a bottle feeding should look like. And starting from that, we're talking about breathing. Okay, breathing, like if we're not breathing, we're not going to be living, right? So, the way the baby's breathing, the way, we're breathing, looking at all that stuff. Mouth breathing is not normal, period. It's a compensatory strategy. So if we have a child, even with babies, babies can be already born and breathing through their mouth. And that is going to just dysregulate the nervous system and set them up for all kinds of different conditions that they're going to have problems with, later on in life. So looking at that, and then, going into toddlers and children, speech issues, selective eating, the way they're eating, again, mouth breathing, snoring. Another thing, snoring is never normal. End of story, period. Snoring, it's a indication that there's obstruction of airway, obstruction in the airway of airflow. So if you're stopping breathing or if you're reduced breathing, okay, there's lack of oxygen flow into the body and especially into the brain. So imagine if you have a 2, 3, 4-year-old who's snoring all night long. How are they going to wake up in the morning? Are they going to be refreshed? Are they going to be, ready to learn and be in a positive mood? That's not going to happen. They were just fighting for 8, 10 hours during night to survive. How are they going to be able to function during the day? And these are the kids that are being put on medication, because of behavior issues. These are kids that are tired. They don't get sleep. So, and then later on, we have kids that, have behavior issues at school. We're talking about 11, 12, 13. They are labeled as learning disabled or other things, right? And then going into teenagers, we have people that starting to have jaw clicking, jaw pain, migraines, and going into adults. Later on, if we're not breathing properly, if we're not sleeping properly, we're going to have chronic things, diabetes, high blood pressure, like all those things, metabolic issues. We're not sleeping, we're not cleansing, we're not restoring, we're not doing all the things that sleep is meant, for, right? We're not getting that restorative benefits.
Right. If I can break in for a second, that's all I hear now. Okay. I've got sleep apnea and everybody getting their machines out and putting their mask on at night. You know what? There's only one virus that is actually traveling around the world that's actually alive, because viruses aren't alive, but this one is. It's called victimitis. They are turning us all into victims, and we actually believe that there is nothing we can do for you except you need to take this drug or you need to have this breathing device when you go to sleep at night, okay? You know what? If man can make it up and make money off of it, they're going to do that. So what are we going to do? I mean, the majority of the population are falling for all of this, and understand, everybody, that if you don't get your sleep, you don't have energy and you don't think clearly, you make stupid decisions. When you're exhausted and tired, and understand something, the main thing that, and I don't mean to make this into a political or a controversial show, but understand something. You need to understand they have one mission out there, and that is that sick people cannot protect themselves or their family. Margaret?
Yeah, and if I can, talk about the sleep apnea for a bit, the CPAP machine is not a solution to anything, and actually the compliance with CPAP machine is like less than 10%. So everybody is going there to get the CPAP machine, but people don't use it because it's uncomfortable. And it's, like imagine sleeping with this mask on and with all the tubes and all that stuff. People don't use it, right? But in anyways, it doesn't solve anything. So it is just a pressure of, it's just a pulse of air, that is pumped into your airway to pop it open when your airway is obstructed, right? So if your tongue is in the way, if your airway is collapsing on itself while you're sleeping, it's just a burst of air that's popping your airway open so you can maintain breathing. It does not do anything else. Like it does not provide, there are some other people that have like COPD and things like that might have like oxygen in addition to it, but it doesn't have any other benefits. And you actually don't even get a good night's sleep with it because you have this stuff on your face, so.
Right. But COPD, there is no such thing. COPD is where the alveoli are filling up with mucus from the infection and creating inflammation. So the mucus is to protect. I mean, if they started nebulizing with infinite iodine and silver bullet or bright eyes fulvic, or just got on a non-inflammatory diet, I mean, their life would change. Just basic things. But so what do you do with people when they come in or do people come in for this often?
Yeah. And so we work with a lot of adults that, have been everywhere, have tried all these things, and either, they start like taking their life and their health in their own hands and start doing their research. Or, they are fortunate enough to see a provider that says, hey, go see Margaret, look into myofunctional therapy. That might be, something that might help you. Right. And so regardless of how people get to us, we work with them and figuring out is what's causing the fact that they're snoring, the fact that they're stopping breathing at night. Those are people that may have gone through sleep studies. So we know that maybe they have, in an hour, they stop breathing 20 times, right? So that's the apnea index. But, regardless of this, I do a full mouth evaluation and see how the mouth, first of all, what the structure looks like. So how wide and forward is your upper jaw, the roof of your mouth? How, wide and open is your nose? Can you breathe through your nose? Where is your tongue sitting in the roof of your mouth? How is your breathing pattern? Are you able to use your diaphragm, or are you just, kind of breathing shallow and fast from your chest, right? So looking at all those things.
Right.
And then looking at muscle function. We have to understand that when we're born with a certain structure in the face. And then we have to figure out how to do all these things functionally. Breathe, suck and swallow, right? And then later on, chew food, swallow food, and then speech. So for all the things that we use our mouth. And so I look at the muscle function. How did this person develop their oral rest posture? So where is the tongue resting in the mouth? How is their tongue functioning for those, things, chewing, manipulating food in the mouth, swallowing, and then speech. And then, we go from there. So typically there's a structural component, whether it's a tongue tie, whether this person was already born with, a face, the upper and lower jaw that were set back and restricting the airway, whether it is, a narrow jaw, high narrow palate, all those things. And we can go back and talk about, what's causing it in utero and things like that. But we have to see like, what is this person here right now with? What do they have, and what can we do for them? And a lot of times it may involve going for a tongue tie release. Maybe it involves
That's a surgery, right? Tongue tie release is a surgery.
it is a surgery. It's done with a CO2 laser. I can
Is it complicated? Is it in and out or no?
It's a not complicated at all. It's a very fast procedure. However, it's not as simple as just going in and getting it done. There's a whole things of a whole list of things that we have to do before and after the surgery to make sure that it's done correctly. It's not about just getting it released. It's the healing process. You of all people know, the impact of scar tissue. So
yes,
we are very on top of that. Make sure that there's no scar tissue afterwards. There's no reattachment. So we have to really, really work on the healing. We have to, have the person be trained on doing their stretches, their exercises. The more we can move the tongue, there's other things in the mouth that sometimes need releasing. There's actually 7 places where you can have a tie in the mouth. So depending on what needs to be released, we need to have people understand.
And can I say this? There's people out there that have a tie in the mouth and they don't even know it. They don't know why they're all tied up.
100%. Yes.
And guess what? I got 2 things for you, and then I'll let you speak. What would be the things that I would look for that I didn't know that I even had the problem? Help me with that. Mm-hmm. Okay. And the next thing is, why is it, I don't do it all the time, but if I'm laying back on my back, okay, I will sometimes do this. I'll be sleeping and then I'll go and like that and scare the living out of myself.
Okay. So
why do I do that?
Okay. Let me go back to the first question.
Okay.
So right. There's different signs and symptoms that we can look at at different age. So I could be talking about this for a long time. However,
well, I'd like you to take as long as you need to talk about this, because we need to let people, okay, just so everybody understands that Margaret's brilliant, and you're going to find that, and you're going to find out that she shares the most unbelievable information that you can bring relief to yourself and your family. This is not a commercial. This is real life. Margaret?
So I'll start with adults. Okay. So in adults, if you like that is a symptom. Okay. What you just described, where, you lay back and maybe you're like falling asleep and then you're going to wake yourself up. It's because something was blocking your airway. So your body, your brain triggered you to move around, to wake up so that you can continue to breathe.
But why the snort?
Because something was blocking your airway.
Okay.
In the airway, there's multiple places where a blockage or, obstruction can happen. Most often is the tongue, but it doesn't have to be. But most often we see that the tongue is the problem. So if your tongue is not resting on the roof of your mouth, when you go lay down, where is it going to go? Gravity is going to pull it back, right? So it's going to be right in your airway. And if you're, not able to take it out of there, what's going to happen is as you're taking breath in, you're going to hit the blockage because you're pulling in negative air or negative air into the airway. So just by physics, you're going to collapse space. And so that's the snort. You're doing that, right? So that's, but it doesn't have to be the tongue. The little dangly thing in the back of our throat, the soft palate, the uvula, that sometimes is too long, or just, there's no tone in it. And that can be also a problem. So as we're breathing, we're pulling that in, creating that obstruction. And because of that, you can also get that little snort. There's also things in the nose. Okay. If your nose is, congested, if your nose is too narrow, there's, no, or not enough space for the air to go through it, you will collapse the airway on itself. Your nose is not a hard tube. It is a flexible space. So it will collapse on itself and create like a snort.
So if you have like sinusitis continually, you're going to have swelling, and then you're going to build from inflammation. Then you're going to build scar tissue up. So that can even cause a problem, right?
100%. And then guess what? If you're not, you're congested all the time, whatever the case is, if you have swelling, if you have mucus, your sinus is not able to drain, you're going to end up being a habitual mouth breather because your number one function of your brain is to keep you alive, and you have to stay breathing.
Right. This is not a pitch, anyone, but, people will come to us and say, I have a deviated septum. I have to get surgery. It takes us exactly, and I haven't had anybody come to us that we haven't been able to do it. It takes us no more than 5 minutes to actually get rid of that deviated septum or the breathing problem when it's just a scar tissue thing. We're not talking about Margaret's work. And also, I have a lady that I just worked on, and Margaret, she had a breathing problem, but just to show everybody how bad this can be, Margaret, her face was swollen by about a half an inch more than the other side. And I asked her what was wrong, and she said, and that's because they say that I have a deviated septum, and I believe it is deviated, but it's not needing surgery. I told her, I said, I'm pretty sure I can fix that. And I went in and I started doing the non-surgical here up where the problem was on that side where she was swollen. And then I did the other side. Then I came back to this side, and guess what? You could hear this in the whole room. And this was a Hutterite family. So there was about 5 of them there, and all you heard was snap. And guess what? The nose snapped, went back into place, and the swelling came down within 30 seconds in her face, and she had it for 10 years. So that's how much problem that breathing can cause. So I'm just trying to say that I can't do what Margaret does. I'm just giving an example what happened in the last couple of weeks, what I know. Okay,
yeah,
Margaret?
but here's the thing is, that it had to be done for this lady because, she's been living with this for so long. She had this chronic problem. What needs to happen right now? She needs to go through a breathing retraining because she hasn't been able to use her nose for all this time. She is a habitual mouth breather, and it's not going to snap just like her nose did as a functional.
I know everything is muscle memory. Everything is muscle memory. So, whatever you do the most is what you become. And that's like right now, most people are so fearful about the end of the world coming that every day they have that image. And so just like her breathing, if you're right. So I never told her that, never thought about that. You know what? I never thought about it, but you know what? I'll tell her.
Yeah.
Oh, and Margaret, we should have done this earlier. How do people get in touch with you?
So I'm on social media, so you guys can look me up there. My website is mytherapywellness.com, and I'm on Facebook, Instagram, and TikTok. You can call my clinic. The clinic number is 815-782-4196. Get in touch, message me on Instagram, message my clinic. We, have people that can answer your questions as well if I don't get back to you. But, what if I live
in another country?
That's okay. We do.
Can you do a consultation for me and my child?
Yes, 100%.
Okay. All right.
I do have network of people that, let's say you do need a, tongue tie release or you need an orthodontist. We have network of people that have similar training, understand what we do. We collaborate with each other. We all attend the same conferences. We, share the same research. There's people that do research and things like that. So I have access to, people worldwide, wide to refer to if that's the need. But we do telehealth consultations, and we can do an assessment on you or your child via telehealth. So if you don't live in the area. But yeah, going back to your question on symptoms. So as an adult, is the mouth breathing, okay? So if you know you sleep with your mouth open, if you snore, or your partner has reported that you snore, if you wake up tired, if you feel like you need coffee in the morning, you need coffee in the afternoon, you need something sweet, you don't have energy to last you throughout the day. And then another symptom may be TMJ clicking, TMJ popping, grinding your teeth. Grinding your teeth is actually a symptom of airway issues. So you're constantly all night long trying to pull your lower jaw forward to open your airway. If you wake up in the middle of the night, if you wake up to use the restroom, that's a problem. There's a protein that's released by the heart that gives your bladder an impulse that, it makes you go pee in the middle of the night. All those things as an adult are problems. Like, it's not normal. If you go to your doctor and you're 40 or 50 years old, it's like, oh, I wake up 5 times a night. Oh, it's normal for your age. No.
Well,
it's just
no, but you're wrong,
do it.
Margaret. You're wrong. It is normal because all they do is go by stats.
Yes.
Whatever's normal, whatever's going on today is normal. It's abnormal if you go back 10 years.
Right. Yeah. But it's just because it's common, it doesn't mean it's okay to have that. Right.
That's right. Common is normal. Okay. And being healthy is abnormal. Got it.
Exactly. Yeah. And the thing is, if you tell somebody that you're on the, plant-based diet, is like, oh, you're special, or, it's a diet. It's not a diet. It's a lifestyle, right?
It's a live it.
Yes. So you have to understand that difference. For example, waking up in the morning, rested and having the, vitality and the energy to do what you need to do during the day, and also have that emotional balance. Because if you don't sleep at night, like, you're not going to be emotionally balanced to, like, handle everything that is thrown at you all day, your kids, your work, the traffic, whatever, that is just all of those things build up. And you, Dr. Wolf, know about the emotional side of things, right? If we're in that constant negative emotions, like, what is that going to do for our body, chronic health wise, right? Long term. And all those things are going to start building up. So that's with adults. Now, younger kids, things that we see is, speech is primary problem, and then selective eating. A lot of parents don't understand what selective eating is. Eating chicken nuggets, French fries, and yogurt all day, every day is not okay. Even though that is, the typical toddler diet, or, typical kids menu. No, kids that are 3 years and older should be eating like all of adults. If they're choosing to eat chicken nuggets, yogurt, macaroni and cheese, is there something going on? And a lot of times is also the behavior component of us parents feeding into that, because nobody wants to do things that are hard. So if eating, raw carrot or raw celery or an apple with the skin is difficult for me, I'm going to go for the yogurt because that's easy and fast. I don't have to work for it. Or if in any way I can't chew and properly that food, and then when I go to swallow, it feels weird, it's too chunky, or it threatens my breathing in any way, I'm not going to do that, because that is, a threat that I feel in my body. So kids learn that really quick. But at 2, 3, 4-year-old, they don't know, they don't have the cognitive capacity to be able to explain that. Oh, mom, when I eat that carrot, it really feels weird in my throat. I feel like I can't breathe, or it feels really chunky, and it kind of, freaks me out when I swallow it. That's why I don't want to eat it. They don't have that ability to communicate it in that way. So
so why would I feel that way? Is that more emotional than physical?
So it's both, because if you swallow something that it in any way feels like it's a threat, right? Because when you swallow, you pause breathing, right?
Yes.
We shift the tube. So when you swallow and it feels like it blocked your airway, or you had to, like, work hard to swallow it, or it felt uncomfortable, you're not going to want to do that again. Does that make sense? It's like, it's almost like getting, or if you have children that have choking experiences, if, let's say, somebody, chokes on a piece of carrot or a piece of meat, they're not going to want to eat that again, or anything that looks like it, because of that negative experience. The negative experience is already stored in their mind, and
trauma is stored 10 times greater than any celebration.
100%. Yeah. But a 2-year-old can't explain that to you. So the only way that they can tell you that they don't want to eat it is they're going to throw a tantrum. They're going to tell you no, they want this and they want that. And as parents, we want what's best for the kids, right? We don't want to fight with them. And so we give into those things without even realizing if there's anything else going on that, could be contributing to why this child is selecting to eat other things. Right. But we got so normalized to, like, the kids menu. It's like, nothing bothers me the most going to, restaurants is kids menu. It's training children to be picky.
Yeah, and it's training children to become sugar junkie, alcoholics, and they no longer are picking foods that are high vibrational. They're picking drugs and chemicals because that's all you're getting. That's what the kids' menu is meant to be: cheap and poisonous.
100%. 100%. And it's a whole, the whole thing is just a vicious cycle, right? So if you have a child who has mouth dysfunction and they have to adapt to be able to eat something, right? They start on these things that are, sugary, that are carbs, that are processed, that have food colorings and all that stuff. And they get addicted. And then it becomes behavioral thing. And then at 4, 5, 6, 8, that's all they want to eat because they're already addicted to these foods, right? And so they're not, and you can punish them and you can do all these things and you eat your vegetables and do all that. It's not going to work, right? So there's a lot of things that we have to undo, with these kids when they come to us. And a lot of it involves parent education.
Margaret. So that's the thing, eh? Mm-hmm. So I'm really hoping that you put some kind of masterclass together that we can actually put up for families, okay, to help them with this situation. Did I put you on the spot?
I never say no. I have a lot of things going on, but I'm not saying no. So maybe down the line, we'll work something out and we'll produce something that is there for parents to use, because honestly, we don't know. We don't know.
No, you know what? Either. Isn't it crazy? Go ahead.
I know. And I tell my parents, like, I was in the same spot. I did not know what was going on with my child. And I'm, a medical provider thinking I'm, a speech language pathologist. I should know this or that. I was trained on tongue ties and all these things. And I'm going to neurologists. I'm going to OT. I'm taking my son to, speech and PT and doing all these things. Yet he's 5 years old, sleeping with his head over the edge of bed, right? I'm like on him. He's like, you need more sleep. You need more sleep. He sleeps for 10, 12 hours. I can't get him up in the morning. He goes to school. He's tired. I have teachers reporting that he's like half asleep, putting his head down. He doesn't pay attention. He's not completing his schoolwork at 5 years old. And then they're like, oh, maybe he's too young. Maybe he should go back to preschool. And nobody tells me, like, the way he's sleeping is not right. The way his mouth is functioning is not right. The way he looks is not right. He did not learn how to ride a bike until we had his tongue tie release and mouth expanded with orthodontic appliance to get him sleeping better. He could not go up and down the stairs without holding onto the railing at the age of 4 because he had balance issues. He was toe walking. He was low tone. He had all of the things, if you look at symptoms of muscular dystrophy, he had all of them down the bullet points.
But meanwhile, he doesn't have them. And if he was diagnosed with that, then we're going to go down the road of hell.
Exactly. 100%. But you know what? He had all the symptoms as an infant. I couldn't breastfeed him. He had recurring ear infections. He had recurring upper respiratory infections. And nobody said anything. And on top of that, his dairy and soy and wheat allergy, which I had to tell my pediatrician, no, I need you to test him. At 6 months old, he still had cradle cap on his head. He had skin issues. I tried all the lotions, all this stuff, you name it. None of that worked. And so I had to tell my pediatrician, no, I need you to test him. There's something else going on. So at 6 months old, I got him tested for allergies, and on a skin scratch test. So you can imagine how severe his allergy had to be on a skin scratch test to come up with soy, gluten, and dairy allergy. And so we switched his formula because at that point I'm no longer breastfeeding because that went to garbage, and in 2 weeks his skin cleared out. But then he had issues. He continued to have issues. And it was all because the way he was breathing, that was not addressed. If somebody told me when he was born that he had a tongue tie and we had to get that taken care of, we could have avoided all of those things.
Okay, so here we go, everyone. Just so you know, all right? we're introducing these little spirit beings onto the planet. This whole thing is a setup. I guarantee you that there might be 1 out of 10,000 parents that actually have just even a few basics on how to raise children. I said this at the beginning, didn't I, Margaret, that if the medical system would have left us alone, and they never even got involved in our lives, and they are only there for emergency care, we wouldn't have this show right now. The reality is, as human beings are beautiful, they're highly intelligent, and they've been dumbed down. And I'm telling you right now, everyone, that if you're thinking of having children, if you already have young children, or if you care about your children, then you better wake the heck up. And the reality is it is nothing is normal anymore. Nothing is normal when the doctor says this is just normal. Because understand something, medical doctors are not doctors. They're surgeons, they're physicians, and they're only taught what they're taught. They get 80 minutes of nutritional, how can I say this, lectures during their whole medical regime. They know nothing about health, and everybody better wake up. And you know what? I don't mean to say this, but if you're going to take your child to a doctor, a medical doctor, I'm not going to tell you that you get what you deserve, but understand something. You're not going to like what you get.
Yep.
And if your child isn't having a life-threatening emergency, what are you thinking? Mm-hmm. What are you thinking? You're not. You're reacting, okay? And fear. And that's the only thing that they have to overpower us is our fear. And once you have intelligent information, you'll no longer have fear again, and understand something. And that's why Margaret and people like her are God sent. Margaret?
Yeah. And like I was saying, I didn't know any better, right? But once you do know better, we have to do better.
We have to.
You can't go back and listen to the doctors and whatnot and put your kids on antibiotics because they have ear infections and put ear tubes in their ears and stuff like that. Why are they having ear infections? What are they?
By the way, Margaret, there's no antibiotic that helps an ear infection. It's not true.
Right.
You put it in your mouth, it's got to travel all the way down through your stomach. Then it goes to your small intestine, and then it goes off like an atomic bomb to the good and the bad bacteria, and it changes the yeast into fungus in your large intestine, screws up your whole metabolism. Unless somebody has a life-threatening situation, they should never be on antibiotics. Life-threatening, because antibiotics cause life-threatening situations to children.
Right. But going to the root cause, why do kids get ear infections? The eustachian tube opens when you swallow. If the child's having a hard time swallowing correctly, they're not opening and draining the eustachian tubes. The ear infection is a buildup of fluid in the eustachian tubes. And then when it sits there, then it gets bacteria and whatnot, right?
Yeah, like a swamp. It sits there, stagnates, and guess what? What came first? The mosquito or the swamp? The swamp came first, and now we've got the infection.
Right. But it's the same for the sinus infections. It's a cavity. It's like a cave, and it's dark and it's moist and it's warm and it's a perfect environment for bacteria to grow. So if you got stuff sitting in there, obviously something's going to come up out of it. Right. So if you're not breathing through your nose and you're not draining the sinuses properly, you're not filtering the air and all this stuff, that comes into your nose, right? You're going to be more prone to sinus infections. And same with the ears. But another thing is the food. If the child, one, is not swallowing properly, then we're not draining the eustachian tubes properly. Then we have inflammation on top of that because we feed them dairy and processed foods and, sugar and all that stuff.
Soy and wheat.
It's a perfect combination to get infection. So that's kind of what I say. But, I like to educate my parents on that. and give them power back. It's like, you don't have to get antibiotics if there's fluid in the ears.
Right.
We can do, deal with that naturally, but then let's look at what's causing that. Why is your child getting recurring ear infections? They put the tubes in the ears. It's a surgery. Then one, it doesn't always work. Number two, they have to put the child to general anesthesia to insert those, right? And then it causes scar tissue. So then they're going to be more prone to hearing loss and things like that in the future, because that's
and what about the way they feel about themselves now when they're younger and they've got tubes in their ears? That's the last thing they need. Okay, because they're just going to hide in a shell because they're going to feel like they're different. You know what? I'm going to tell you something right now. The medical system needs to back off and people need to wake up. Okay, understand this. I want everybody to go back 100 years. Okay, 100 years. Go back 100 years. Look at the stats and then take a look at what you need to do to get close to the type of lifestyle that we had 100 years ago. What do you think, Margaret? That might be a good place to start.
100%. And if you go back, pre-bottles and formula and pre-baby food and all that, how did we survive?
What about the 4-year-olds that still have soothers in their mouth in the crib and they're looking at their mother's iPhone, or they have a big iPad and they're watching cartoons and they got a soother in their mouth? Well, what about a soother? You know what? I have seen so many kids in airports, grocery stores, on the street, sucking on a soother. Yep. And they're like 4 years old still. I don't know what that does. What does that do? That's got to do something.
Oh, okay. So remember I said oral rest posture. The tongue.
Should babies even have soothers? Do you think that's a problem?
We'll talk about it. But going back to the basics, the tongue has to rest on the roof of your mouth. Okay. Starting with this. If the tongue is resting on the roof of the mouth, that is promoting nasal breathing. You can't breathe through your mouth when your tongue is suctioned to the roof of your mouth.
Right.
But it also stimulates the nervous system. So there is a place on the alveolar ridge on the roof of your mouth where, when that's stimulated with the tongue, it releases the good hormones, right? The dopamine, like all the feel good things, right?
The dose, dopamine, oxytocin, serotonin, and endorphins. Got it.
Exactly. So that is the function of the tongue on the roof of the mouth, one of the functions, right? So nasal breathing is going to help regulate the nervous system, and so is...
Can you hold for 1 second?
Sure.
Guess what? Oh my God. Just think of the depression. If you don't have your tongue on the roof of your mouth, you're not dumping the serotonin. If you're not dumping the serotonin, I hope you know, everybody, that the lack of serotonin dumping in the body is the main cause of depression. But the reality is, from my place, I look at it this way. The image that you have of yourself in your life and the thoughts will decide on what chemicals get dumped. But if a person is already fearful or depressed, would the tongue not be on the roof of the mouth because it might just go along for the ride and then cause even more slowing down or shutting down of serotonin, which will cause them to go into a deeper depression?
100%.
Okay, gotcha. Wow,
but
missing. Good.
It starts with the babies. That, 100 years ago, when a mom breastfed the baby, as soon as they were done, she would close the baby's mouth to make sure that they're keeping their tongue on the roof of the mouth and nasal breathing.
Good.
But we don't do that anymore, and so the tongue's resting on the roof of the mouth, right? When we have the pacifier in the mouth or the bottle in the mouth, because there's plenty of toddlers, 2-3-year-olds that are still drinking milk at night from the bottle. Okay. What happens is you're training that tongue to stay low. So the tongue that never has the, opportunity to be sitting on the roof of the mouth, especially if that pacifier is staying in all night long, or if the baby's crying and here's the pacifier, just, just stop crying, right? Because the baby is looking for regulation. The sucking helps to regulate, but instead of having the tongue to do that work, we put a plastic or silicone thing in there to do that job. So that's why, kids are addicted to the pacifiers, addicted to the bottles. And if we take that away, then they go for their thumb or their finger or their blanket. And we call those oral habits. And
did you know that when you said plastic, because it is plastic, did you know that the average adult now has a half a teaspoon of plastic in their brain?
I wouldn't disagree with that at all.
Well, why don't we just put it in their mouth and have them suck on it?
Right? Yeah. So, when the pacifiers in the mouth, when they use the bottle, we promote dysfunctional tongue pattern, which we call tongue thrust or reverse swallow, where that tongue is continuously doing this. Okay. And that's an infant movement for the tongue to be able to draw the milk out of the breast. But past 12 months, we should be on the way to develop the swallowing pattern that is going, the tongue's going up to the palate and back to push the food, not forward.
Good. Great.
Yeah.
Yes.
So when you have all this in the mouth, it changes the shape of your mouth. It restricts your airway. It's going to make your upper palate small and narrow, which you got to remember, the roof of your mouth is the floor of your nose. So if your roof of your mouth is high and narrow, is like that vaulted shape, it's going to go up in your nose. That is going to take away the space in your nose. So now we're also, the high and narrow palate, when that, child grows and develops in that shape for the roof of their mouth, that's going to cause the deviated septum. That's going to cause restrictions in their nose. That's going to cause them, feeling like they're not able to breathe through the nose and they're going to be mouth breathing. The mouth breathing then is going to promote that narrow and elongated face. We're not going to have the jaw space. We're not going to have space for the dentition. It all goes together. Why are all these kids needing orthodontic treatment and braces? Is because they don't have sufficiently developed jaws. There's not enough room for all the teeth to come in. We're meant to have 32 teeth, yet a majority of people nowadays have 24, 28 because everything's being pulled and there's no room for those teeth to grow. And when we pull the teeth out, we further restrict the airway because the bone is going to collapse. There's nothing holding it in place.
Oh my gosh, the whole thing, everybody says, oh, Daryl, just another one of your conspiracies. Well, it's a conspiracy until we get all the pieces of the puzzle together, and then everybody goes, well, we still won't talk about that one. I got one other thing, and then we're going to let everybody know how they get in touch with you, and then let's talk about your upcoming show, your upcoming shows, but when we're going to be starting those. I've got one other question, if you don't mind.
Sure.
Okay. How is it that we've got now children wearing diapers till they're 3 and 4 years old? The whole marketing thing is just amazing out there. I talked to parents, and I think that I keep saying, why don't we go back? I mean, wow, everything is a corporation marketing plot, isn't it? Don't you see? People are wearing children are wearing diapers longer than they've ever done when I was a child.
Yes, but what I think it goes back to their sleep. So if they're not able to breathe and sleep properly, they're going to be wetting their bed, right? And so parents don't want their child to be wetting the bed, every night. So they're going to be putting those diapers on, right? And then during the day, also, then it turns into a behavioral thing. So as human, we want to do the least amount of work possibly we can. So it's easier for the child to have a diaper on than actually go use the bathroom. So that is,
I think honestly, and I don't know if I should be embarrassed, but I'm not. It's been so long, but I'm not sure what it was, but I think I wet the bed until I was 8 or 9 years old.
Sleep.
I used to bang my head when I'd go to sleep at night.
Yeah, it was your sleep.
Yeah.
Mm-hmm. I think, Dr. Wolf, you might need a myofunctional evaluation.
A what?
you, you need a myofunctional evaluation so we can look at your mouth, see the structures and the function of your tongue, and kind of how everything.
Well, come down to Ixtapas y Huatanego, Mexico, and give me one then.
I'm on my way. Yes.
Okay. All right. Okay.
So yeah, that's what I think is, it starts, and like with the feeding I was telling you, I was talking about, it starts with a problem. The child has a problem. They don't know why. The parents don't know why. And then it turns into a behavioral thing. And then we just, as parents, not seeking the understanding of what's happening, not getting the answers. We just kind of go into it, and then we let the child do whatever they, need to do or they want to do, because it's easy. It's convenience. It's instead of training them to go use the bathroom, right? Use the toilet. It's easier to just put a diaper on them and take them to the store and do whatever you need to do, or do your,
these shortcuts blow up in our face. You know what? Do it right and you won't have the fight. That's it. But people don't know how to do it right. So they're doing the best they can. I get it.
Yeah. And, society is always teaching, like promoting is, these kids have, they need privacy, they need this and they need that. No, like be a parent. There's a reason why there's legal age for driving. There's legal age for drinking. There's a legal age for voting. Our brains are not developed at, 4 or 11 or 12 to make rational decisions. So be the parent. And decide for what's best for the child. Don't let them decide what's best for them.
Yeah, that's another topic, isn't it? We won't touch that one with a 10-foot pole today. Okay.
So, but you have to take responsibility at the end of the day, and that's the bottom line. If you don't responsibility,
but honestly, when you say that, I think we have to say you need to take responsibility, but you're not going to find out how to do it. Okay. Well, because they're not going to find out how they do it unless they come on some kind of show like yours when it comes to the children, or they come on a show like mine when it comes to all the other things that I talk about. We are not the alternative. We are the original. Right. That's all we are. Well, our information that we're sharing with everyone isn't 100 years old. It's thousands of years old. Okay. We were never the alternative. So understand something. Margaret is not the alternative. She is the primary giver that you need for your children. And that's it. Margaret, how do people get in touch with you?
Again, you can look me up on social media. My clinic is Advanced Therapy and Wellness Center, and we are on Facebook, Instagram, or TikTok. My website address is mytherapywellness.com. My clinic is located in Crest Hill, Illinois, right outside of Chicago. If you're in the area, call us, call the clinic. I have my wonderful admin staff to answer any of your questions that you have. And our phone number is 815-782-4196. You can also look my personal page up on Facebook or Instagram and message me directly if you have questions. We do telehealth. So if you have a symptom that I was talking about, or if your child has a symptom I was talking about and you are interested in getting evaluated, we can do that via video as well. So I also, done evaluations when I'm on the road. So like I'm in California right now. If you're here and you want to meet up with me and to get an evaluation, we can also do that. I travel a lot, so I'm either in Florida or in Phoenix, Arizona area,
or Ixtapa, Mexico.
Or I'll be coming to Ixtapa at some point. Hopefully I'll join you for the class in October. So hopefully that works out. But message me. And like I said, I can do things virtually. We can do things in person. I had people fly out to my clinic all the time. So that's an option as well. If you rather, want to come in person and get Salsonic also at the same time when you're in town, or non-surgicals, we do that, and nutritional consults and all of those things. So Let me know. Get in touch. I'm always happy to help. I'm always happy to find local providers for anybody that's interested in help, and anything I can do.
Okay, so when is your next show, and what time, and what's it going to be about?
I really want to take people kind of from the basics of
Beautiful.
the basics of breeding, and talking about then the feeding, how we develop chewing and swallowing, and how to encourage that in babies, and then go from there. So go through the whole lifespan of things that are potential symptoms and things, and what we can do about it, right? And then all the way through adults, if have all these things, what can you do? How there's other things that you could do yourself to one, test yourself if you need somebody to see a professional. So then you make sure that you know that, okay, I have an issue with this. I need to go somebody who knows more. I can't help myself. But there's also
Right.
other things that you can start doing yourself to help you, whether retrain your tongue to the roof of your mouth, whether it is to retrain your nasal breathing and things like that. So there's all these things that you can help moms with babies. I want to talk about the pacifiers, the toys, the bottles, like all those things. Just because you go to Target and you have 2 aisles of products doesn't mean that you need all of them, or that they're going to be great for your child. Marketing has its purpose, and everything in the store is marketing, right? But there's zero to none of research behind using these products with the babies, and what kind of effects it will have on their face growth and development of those functional skills. So you have to understand what it is that you're buying, what it is that you're using, what it is that you're letting your child play with. And so those are all the things that I want to talk about. And I don't know. We set a date, September 25th, I think is my first show. I don't know what time we set is going to be yet, but I think that's the date.
I think it's probably around this time, isn't it? I don't know, but we'll have it, everybody. We'll be advertising it, and I'll be putting a whole list of the BHN TV shows up when I'm talking in the next few days. We're organizing everything here, and it'll be all buttoned up and tight. And the BHN app comes out on the 15th. And that means that most of the shows, if you want to see them, you're going to have to go to the BHN app, everybody. We are only going to be doing the odd show on the platforms, and we'll give you little snippets of different shows that we're doing on BHN app. But if you don't join bhnapp.com, then you won't be getting most of it, because the reality is nobody's going to tell us what to say or what to do or how to do it. And we are here. We are the people's platform. We are BHN TV, and we are going to give you the truth on all levels. I am going to be bringing on a show called The Unseen Universe, where we're going to go into actually talking about things that we need to understand, and how we are the universe, and how everything in the universe is connected to us. And I'll be bringing people on like that. I'm even going to be bringing somebody on that will actually help you, to show you where the world's going, even on a financial level. That is not my realm, but I'm telling you right now, the majority of the population is going to lose their health, and already is, and the majority of the population is going to lose their wealth. Okay, I truly believe that 60% of the population that are middle income will actually be at the poverty level within another year. And I'm in the health business, but understand, if your wealth gets stolen from you, that is going to really hurt you and injure you. And I'm telling you right now, that does not sit well with me. I am not in the financial business, but we are in the business of helping our Braveheart Nation. So understand that I will get the best that I can on Braveheart Nation in the way of shows, to show you that we've been ruled, schooled, and fooled for hundreds of thousands of years, and it's never going to stop. But you can opt out if you want, if you can find your Braveheart. How would you like to close off, Margaret?
I just want to say thank you so much for having me, Dr. Wolf. This information is not mainstream, as you said. It's not, you can't easily just search up things on Google because things are being blocked. Obviously, if we get to the root cause of things, we're taking customers, from the pharma and the medical system, especially if we get to the root cause of things early on in life, and not creating a customer for the medical system to take advantage of for years to come, right? So this information is not something that is available. And also, when we do put out research and we have this information, going in viral, then they will, kick it back with something that is posted in New York Times when it talks about how all of this is a scam and it's for financial gains and all this stuff. And there's no research, no real data behind any of their claims. But, I see the impact that what we do has on, the families that come to me. I seen the impact it had on my own children. I will be going through some stuff with my mouth as well. So on the show, I'll be sharing that journey and, just dealing with lifetime long, of problems with my mouth and things like that. I finally have the time, and am committed to going through that journey. And yeah, like I said, it's whatever you feel in your gut is the right thing to do, you should be doing, and definitely making sure that you understand the information and getting to the right sources to where you're finding their information. And sometimes the New York Times is not the best place to start looking at answers for why you or your child has health issues.
Beautiful. Can you tell people where to get in touch with you one more time?
Sure.
And if before you do, I just want to say this, everyone. We have what's called the Doc of Detox Library. And in the Doc of Detox Library, you're going to find the Breathing, Feeding, and Beyond Guide. And Margaret will be adding to it when she can, to the guide, information, okay, to back up different things, studies, things of that nature. And you'll be able to go into the library and see that if you wish. Okay, different studies, things of that nature. And then you can also, if you go into that guide, she'll have all her information on how to get in touch with her if you lose it. It will be there. Okay, in that guide will be all her information, her bio, everything that one stop. Okay, Margaret, go ahead, love.
Okay, so again, my clinic is Advanced Therapy and Wellness Center in Crest Hill, Illinois, right outside of Chicago. You can check us out on my website at mytherapywellness.com and Instagram, Facebook, and TikTok. If you wish, you can call the clinic at 815-782-4196. You can also find my profiles on Facebook and Instagram and message me directly there.
Thank you, Margaret, and have the best trip of your life in California. And we'll see you real soon.
Thank you so much, Dr. Wolf, and I'll see you all Bravehearts out there very soon.
Bye now.
Bye-bye.
Well, I hope you enjoyed the interview with Margaret. I know I did. I learn every time I talk to her. And isn't it something, something so important? Well, shouldn't we look after the front door? Because the front door leads to everything else, doesn't it? If you want to take a look here, you can see BHN TV Guide. You can take a look at the shows we have. We'll be adding Margaret's to it. And I will be showing this in the next couple of days. Her show will be added to it. But you can see all the different things that we have going on in the guide. So take a look and see what triggers you, what you would like to see. All right? And understand this, everyone. My mission is to create BHN Power Pack clinics all around the planet. I just want to tell you why, okay, I'm doing it. I've told this story before, but I want to say this. You know, I've been in the business now for 43 years. I know it's a little bit long, eh? And the reality is this. When I started off, it was just asthma, arthritis, hemorrhoids, constipation, diarrhea, arthritis. Okay, we'd get the odd a stage 4 inflammation patient, which they call cancer, which we do not use that word because it is a misnomer. And but the reality is today, because of the air, the water, the mental pollution that's been going on, and the reality is today that most people are walking zombies when it comes to their health, their wealth, and everything and their family. Nobody knows how to be a parent. Nobody knows how to be how to love themselves. And when I say nobody, I'm not saying nobody. I mean the majority. My apologies. And the reality is even when it comes to health, I can't do what I did even 20 years ago. If I were to function off the same nutritional supplies that I used to use, the same techniques, the same strategies, okay, I would never be able to give a money back guarantee with my treatments, my trainings, my courses, and basically almost everything we do. We had to understand that we are vibrational frequencies, and we have to bring the frequency up higher than the frequency that they want to lower in us. That's what they're doing. Everything is about lowering your frequency, dumbing you down, making you stupefied. Okay? People are not stupid. Their belief systems are. People are not grumpy and miserable. They're toxic. That's it. And people don't have belief systems that will enrich their life. They sell us a fortune cookie. That's all they do. And I told you already, they can control sick people. They can't control me. And I say it loud and proud on all my platforms. There is no authority over me. I humble myself down in front of the creator of everything. But there is no authority over me on this planet. And understand this. I need to create Power Pack clinics because that's how we turn people around. You watch our Power Pack show. You listen to the people that buy Power Packs, whether it's a Cellsonic Regeneration, a Cardio MedBed, and they learn how to do the non-surgical, and they use our nutraceuticals, which are the highest vibrational frequency. Our nutraceuticals have the highest vibrational frequency of any supplementation because they're not supplements. And understand something, everybody. If you don't want to buy my product, go find somebody that has products as good as mine or better. Take 30% of your grocery bill and start giving them key supplementation, your family, like the Perfect Day Multi, like the Beyond Ormus Minerals. I mean, the Daily Cleansing Tea and Black Gold. Those 4 things, if you just did those 4 things, you'd be rocking your family. You'd see symptoms fall right off. I'm not making this up. I have not put my prices up in 9 years, and I determined not to do it. We shut down 3 of our fulfillment centers in the United States, opened up 1 in Texas. All right? We have automated that thing so that we didn't have to put our prices up. Okay? Just like I brought my prices down for the courses. And right now, when somebody buys Cellsonic Regeneration for their clinic, I give them a $10,000 training. The Wolf Non-Surgical, the Whole Life Coach certification, and the Women's Pelvic Restoration course, and unlimited support, Q&As. They get to go on our practitioner map. When they buy a Cardio MedBed, we do the same thing. We give a full 25-day intensive training. And then we give Q&As every week and training every week in everything that we're doing. Understand, we are going to create an army of New World practitioners. And understand, even if you just come for the Wolf Non-Surgical, the Whole Life Coach, I get it. But the reality is this. We need to prove to people in a New York second that guess what? They are energy medicine beings. And guess what? When you're using 20,000 volts in a love harmonic and it can decalcify the mitochondria, or it can put electricity, oxygen, and bring flow, proper circulation back to the body with the Cardio MedBed and with the non-surgical, pulling the scar tissue apart to make a beautiful connective tissue within 20 minutes, right in front of your eyes, or taking a fibroid tumor and reducing it. If it's the size of a peach, in lots of cases, you can reduce it 20% to 30% in the first treatment. How is that? Because everything is issues in the tissues. It starts off in the invisible, which is the emotional, the mental, and goes to the physical. And then guess what? And then we're poisoned on all levels. If you want to bring the thunder down, you take a look at my Perfect Day Guide, which is right here. You can download it, pdgfree.com. You'll never read anything like this in your life and you'll go, oh my gosh, he gave this to us free. This is the most amazing, powerful book you'll ever read to take massive personal action and understand that that which created the world, okay, has always beyond loved you. It's never judged you. That is man-made. We've got to get rid of the invisible bonds that bind us. So everything from emotional to mental to nutritional to external and internal therapies is in this one book. You can purchase it at cost. We have a $5 buffer from the time that we run it off, what we pay, and ship it to you. Okay, it cost us $90. We charge $95 to get it to your door. All right? And then there's the DoD 5-star healing retreat here. And guess what? You will never be treated or respected like we will do with you. This is 5-star healing. I mean it. And we have all the energy medicine equipment there. We have 10 pieces of different energy medicine equipment that are the most advanced. And understand something, it's always been about energy, but we'll also teach you how to actually learn how to love, honor, and respect yourself. And you please, you think you do? No. 1 out of 10,000 people love, honor, and respect themselves. I hardly know anybody that love, honor, and respects himself out of myself and Lori and I know a couple of my children are working on it, okay? But the others aren't working on it because guess what? You're not allowed to love, honor, and respect yourself on this planet. And if anybody does it, you're selfish. Really? Yeah. Is that what I am, selfish? Well, if I didn't love, honor, and respect myself, I wouldn't have the energy I did. And if I kept myself on the hook and kept myself full of guilt, then guess what? I wouldn't have all of this to offer everything that I do. I don't know any practitioner that is able to offer everything that I offer. And that's because I'm an infinite light energy, electrical magnetic being, and that which created the universe has never judged me. It's had my back unless I leave it. Okay? But understand something. It's teamwork that makes the dream work, and I'm not buying into anything that's got any guilt attached to it or sinner's syndrome because we don't have time for that anymore. We need to come together as a family. Everybody on this planet. Okay? We need to stop fighting their wars. But anybody who really, you feel you can't get well and you feel you've entered hell, give me a call because I'll tell you right now, you may not have to come down to Ixtapa Zihuatanejo, but understand something. The answers are there. And that's what created the universe has always loved you. Don't you ever forget that. All right. And then my Dr. Sage Wolf will fly anywhere around the world to certify you in Wolf Non-Surgical, or he will teach you and your family how to do the most powerful body work where you are the only practitioners that you need. Did you hear what I said? Unless you have an emergency, you don't need to go to any other practitioners. Understand, the day that you decide that you want to take your life, your health, your wealth, your love into your own hands will be the day that you become the miracle, you become the practitioner, and you become the hero that you've been looking for. I have a course coming up on October the 9th, like Margaret said, and it's called Whole Life Coach. It will be on for 9 days. There's 1 day off in the middle, and then we will have the Wolf Non-Surgical, which is the most powerful body work in the world. Anybody can come to these courses, and we get them from chiropractors to doctors to lay people to couples to people that just finished school. It doesn't matter. You know what? You have been screwed over. Oh, I go to my doctor, your medical doctor? I go to my doctor, you call him a doctor? He's a physician or a surgeon. I'm not taking anything away from him, but he knows nothing about health. He knows about drugs, he knows about surgery, but he doesn't know about you. He doesn't know about you. He doesn't know about the love that you need to have for yourself. He doesn't know about you having a perfect day on an emotional, nutritional, and physical level. I'm not taking anything away from him or her, but guess what? It's none of their business because they're not in the business of health. Tell me I'm wrong. Okay? So then we've got 3 courses going on. It's the Whole Life Coach certification, which is a 9-day intensive on emotional, physical, nutritional, everything you ever needed to do if you want to actually become a whole life coach and actually make great money and actually make a difference in this world. Wolf Non-Surgical, like I said, most powerful body work. Go take a look at Reverse the Irreversible in my library and go to bhnuniversity.com or braveheartnation.com and check out our courses. We also have a 3-day, pelvic restoration course, and it's a masterclass just for women though, all right? And that's at the very end of those two. And we will be teaching it in the DoD 5-star Health and Healing Retreat. Okay, this is our schedule for 2025, and we will be making it to these places. We cannot go any other places because I won't venture that far, because they are going to try to see if they can have at least 3 wars going on all at once within the next 3 months to 6 months. And that's going to cause havoc all over the world. But you need to understand something. You need to focus on your passion, your purpose, and what you want to become. Okay? All right? So understand this. Okay? All our courses are private and personal, and we will certify you. And yes, you have the right to practice after you come to us. And you will be doing better than you'll be doing better than any medical doctor when it comes to health. And you will be doing better than most natural health practitioners, because we're going to teach you what you need to know, and then we're going to support you with all the tools and strategies, and then you're connected to us. And we will be here for you, and we will be here for you. Okay? All right. So these are the pricings on all of our courses. You can check that out. And our app, like I said, jump on, test drive it. You know what? I told a lot of my colleagues, and my colleagues are probably some of the most influential health practitioners in the world. And when I told them I was coming out with this app 3 years ago, they said, many people have tried to do this and they've never pulled it off. Well, right now you can go in and test drive it. And, we even have what's called the perfect match in there. If you're looking for someone that is high-spirited, a partner, and you want a partner of life that is a spirit partner, this is what we've created for. It's not a dating site. It's actually because you know what? I'm going to tell you something. If you could find someone that was on this planet that just had they know that they are mainly spirit, and that this is the adventure of a lifetime, and somebody that wasn't going to trauma all the time, somebody that was looking at this as a journey, and that we're a team and we're not going to be against each other or make each other responsible for loving each other or make each other into victims, that we're going to become our own personal hero and shine that light on each other. And we're going to really work with each other to have the best life ever. That's why I created that in here. When people heard that I was going to put the perfect match into my app, they go, oh my God, you're going to lose all integrity. And I go, no, if I didn't find Lori, I would have wanted to find an app that I know that a person loves, honor, and respects themselves and knows that this is just the meat suit that they need to respect and honor, but they're a spirit being and they have unlimited potential. Wouldn't you want to find somebody like that? Seriously? Okay. All right. So that's why we did it. But there's so much in there. That's only one out of 100 different things that we have built for you that are for free. I said for free. I am a spirit being and I have unlimited potential, and that's why I can give so much away for free, because I have faith and I trust in that which created the universe. And if you don't, then that's exactly what you're going to get. You have everything in your life that you ever created by your thoughts, whether it was conscious or unconscious. Everything that you are, everything that you see, everything that you will be, okay, was all caused because of this, in between this 7 inches. And because you didn't know you were programmed, well, guess what? You need to become your own programmer, okay? And that's what we're going to try to do. We're going to try to see if we can get the whole world on this app and create a Braveheart Nation family where, guess what? Color doesn't matter. Religion doesn't matter, okay? Language doesn't matter. I'll tell you what matters. You matter. As soon as you decide you matter, you will matter. Okay, there's the guide again. You can either purchase it or download it for free at pdgfree.com. Okay? 1 second. If you want to follow me on Facebook, this is how you do it. Some people don't know. If you want to follow me on Instagram, this is how you do it. I don't even know how to follow myself. There you go. And remember something. It's always been about self-care. It's never been about healthcare. It's about self-love, okay? And it is. If you don't know how to love yourself, you don't know how to love another properly. And that's the God's truth. If you don't love yourself first and foremost, I guarantee you that you play love ransom with your wife, your husband, your children, your friends. Because guess what? Nobody can live with an empty heart. They can die with one. And understand, if you're not going to be thankful and fill up your own heart, then you will never be thankful. And once you are thankful, shine that light on everyone else. Learn how to fly. First, love yourself. We are Braveheart Nation, and guess what? Together we are stronger, and that's how we rise. You can believe it or not believe it, but it doesn't matter what they have to say, what they think they're going to do. They are not going to disrupt me or distract me. I am going to love everybody to the best of my ability, and that will be my focus for the next 5 to 7 years until we break through the other side of this chaos. And understand something. For me, it's not chaos, because the reality is when things aren't going your way, that's when you will pay or say, you know what? I can connect to my Lionheart breath. I can keep a slight smile on, and I can focus on my dreams, and I'm not going to let anybody distract me. Understand something. There has never been a war in the last 150 years that you should have been involved in. It's a banker's war. It's a corporation war. And there's going to be at least 3 of them in the next 3 to 6 months that are going on. So if you really want to go to war, you can pick from 3 different wars. Or you can just stay and be at war with yourself for the rest of your life. Or you can learn how to love, honor, and respect yourself and know that you were set up. I am Braveheart. I am love. I am healed. I am Braveheart. Today and every day, from the moment I rise until I gently close my eyes, I will always trust, honor, respect, protect, forgive, and totally love myself, first and foremost, before anyone else or anything else. So help me God. Because I am, I can, I'm love, I'm healed, I'm Braveheart. You have the best day of your life. And let's see if you can walk around with a slight smile and understand that you're breathing. And breathe in 4 seconds in and 6 seconds out, shoulders back. And then understand something. Until you deserve it, you'll never have it. 3, 2, 1. We got this, Bravehearts.